So I'm just going to briefly touch on why we use games to teach and how can games drive engagement. Obviously, there are lots of reasons to use games to teach, but it's important to recognize that games really provide a low stakes environment, and that creates room for experimentation. There's also this element of just learning through play, which is a lot of fun, and everyone can maybe relate to an experience where they've had that in the past. And then using games to teach also creates a unique group dynamic rather than just what Eric was saying about passive learning. It brings people together in a whole other setting and essentially evokes different skill sets that may not be engaged in a typical learning environment. I'm going to just briefly touch here on this framework by Richard Landers that specifically pertains to gamification. And so the concept is that you can take game characteristics and the elements of the instructions and rules and use these principles to shape the behavior and attitudes of the players or the learners. And then those behaviors and attitudes then in turn influence what the learning outcomes are based on the educational goals. It's important to realize that gamification itself cannot replace instruction, and can only improve instruction. And so if the instructional content that you're trying to deliver through games does not already help student learn, gamifying that content isn't actually going to cause learning. You're really emphasizing the effect on behavior and attitude of learners. And also in the context of gamification, really any behavior or attitude can be targeted, as you'll see in some of the breakout sessions that we're going to focus on. We'll try to create games around concepts that may seem difficult to reach through a game, but that's just kind of to showcase that you can really focus behaviors and attitudes. And then another thing to realize about games that they can drive engagement in a way that I think I'll kind of echo some of the things that Eric already outlined in earlier slides, but the famous curve that we know of, the Yerkes-Dodson law, that you kind of need to have the sweet spot for optimal performance. So it can be so complex that it overwhelms you, but also if you're not challenged enough, you won't be at your peak performance. And this is important in the context of something obvious. So some of the obvious points to note is that, and the following are backed by research, is that when learners put little cognitive effort into learning, the learning is decreased. And then obviously that if we know that students don't participate in an active learning in communities, they end up benefiting less. And when students are not engaged in schoolwork, academic performance is also lower. And so those are all the reasons to find this sweet spot through game design. And there's that element of emotion that essentially pans your attention to the things that you should be focusing on, and then having that enhanced attention and motivation would enhance learning. And as we also know, emotion is intricately linked to how we store memory and retrieve memory. And with games, we tap into that part of the brain.
All the panelists here are going to take a second to go through examples of like the gamification strategies they've used in their own practice briefly. Dr. Edwards?
Hi, so I'm Sarah, and I'm an EM senior resident here in the UK. It's quite late at night here for me, so thank you for giving me the opportunity to talk here. So I've been involved in creating several games, mostly sort of low-tech games, and here's a couple of examples. I've created a couple of series of games around sort of Cards Against, mimicking the sort of Cards Against Humanity game that you may have played with a few drinks with some friends, but sort of morph that into sort of, orthopedic related or dermatology or ECG, and sort of having that, sort of card game moving across the table, that collaborative effect with the game. And a bit like Teresa, I've also developed a little bit more robustly sort of an actual physical board game. And I'll leave Teresa talk a little bit about sort of, board game development, but these are some of the sort of simple games, very low tech, very low cost, that we'll come to touch upon a little while later.
And these like Cards Against series that you have for orthopedics, for dermatology, for other things, these are all ones that are distributed on the on a web page and easy to print and use for your own teaching sessions if you want to try out someone else's game for your own teaching as well, I think is a good one for those of us teaching, especially pediatric or emergency residents.
Yeah.
And even if they're not, it's probably just fun to check them out anyway. They're really well done.
It's amazing how competitive people get trying to match the right x-ray with the right diagnosis, or the right rash with the right diagnosis. Like, honestly, I've had like nearly fist fights. It's been quite funny.
And that core mechanic really is, it's just matching it's like a very simple core mechanic there, right? You're matching an x-ray to the type of fracture and its management. You're matching a rash to its pathogen and its treatment. It's a very simple thing that you could look at and for your own content, make your own clone of it quite easily and cheaply and quickly.
Yeah, absolutely. And I guess it's about taking things simple, isn't it? But actually the core concept about the game is quite important stuff to learn, and it's just a fun way to play it and a fun way to learn it in a different way, I guess.
Awesome. Paul, you want to jump in here?
Sure. So I'm Pauly Esmoy. I'm a second year family medicine resident in Virginia. And as a medical student, I came up with the game Table Rounds, and I created it with my some of my best friends, and we turned it into something that can be shared with others. And this game really grew out of my study methods in medical school. We just had this approach to quizzing each other that's somewhat non-traditional, and everyone really enjoyed it. And so we decided to create focus groups and kind of develop a game around it. And the driving factor was that really the opportunity cost of not studying is huge. And so there's just this enormous pressure in medicine to just be always on. And any free time you have, you should be doing something productive. And people that go into medicine are just really high achievers, and they just adapt to the environment that can be not so conducive to the qualities we want to have, we try to promote in our patients in terms of balance. Therefore, naturally, there's a lot of burnout and physical and mental health issues and neglect in the medical student population. And so this game was aimed to address some of these factors in medicine. And we also used the reason we designed rules a certain way is because we wanted to kind of replicate some of the elements that are not taught very well in medical school, at least from my experience. And it's harnessing the uncertainty and how you have to struggle with it. In our curricula, we have to know the right multiple choice answer, and there's always like one correct way to do things. But in the real world, you don't get that. And so we focused a lot about the element of uncertainty and developing emotional intelligence and the communication skills that are essential in the real world. And we're not really emphasized that greatly in our curriculum. And kind of the basic premise of the game is that we just have cards that represent different symptoms, lab findings, diagnoses, and treatments. And then you match them up in different ways to create a teaching point. And that's kind of the very basic essence of the game. And so the same set of cards in the same game can be played in so many different ways, just depending on who's in the audience and on your creativity level of what connections you can come up with.
Oh, and then the game that I use a lot of small like gamified exercises and sort of on the fly game, sort of strategies for my teaching. What got me into this is a game I've developed called Empiric, which is at its core really trying to use sort of almost like a trading card game sort of vibe, that there's antibiotic cards that are color coded versus based on mechanism, have little iconography that say which pathogens they cover, and kind of using that visual memory that you're accustomed to with playing card games, that you would, I'm holding a green card, I know that's going to work on the ribosome, so I'm learning that doxycycline and linezolid and azithromycin and all the ones that I'm picturing in my head in that green color are medications that work there, whereas the blue ones I know those are going to be cell wall working antibiotics. So using that kind of color coding as well as iconography for specific important pathogens like Pseudomonas, MRSA, that sort of thing, using a little bit of that sort of coding for us to learn the antibiotics in our heads, and then just adding again sort of a simple matching mechanic where you match antibiotic cards that are guideline based to treat infections. So you see otitis with conjunctivitis here on there. I know, oh, that's Haemophilus, so I need to use amoxiclav. So the game is simple, but the idea is to get those cards in people's hands that have that coding of the information I really want them to learn. Dr. Chan?
What we did at McMaster is that we created 2 board games that basically represent different aspects of emergency medicine care. So the first game is Gridlocked, which is a board game that mimics a busy emergency department where you're trying to take care of the patients. You role play the team that's the providers. So you're the physician, the nurses, the consultant, the radiology team, like, and you're moving around to try to take care of all the things that needed to get done. Like every patient comes in with a list. So there's some resuscitation patients, there's mistakes that happen, there's event cards where you might decide to order pizza, and so everybody gets extra superpowers for a turn or two. There's like, the med student card, and the med students design this card, so it's not me. Like, if you roll an even number, they're really senior medical students, so they add to your productivity for a turn or two, or up to 5 turns. And if they're even number, they're a med student who's pretty junior, so they slow you down and decrease your productivity for a turn or two, or maybe up to 6 turns. And so it ends up being this kind of like fairly kind of game-based mechanic that breaks down all the flow procedures that help people understand what happens in a busy emergency department. And we've played it actually with some of the healthcare interested high schoolers. And by turn 4, I swear I was talking to like 2nd-year residents. And there are 7-year-olds that apparently have played this game with their parents who are emerge docs. And they're like, oh, I finally get what you do at work. And then they wake them up before it's time to go to shift and make them play, because like they want to go to work with their parents first, which is a lot safer than going to the work with their parents right now during a pandemic. So that's kind of the idea. Triage, however, is more of a matching game. So in mass casualty triage, one of the things you have to learn how to do is decide if someone needs to seek immediate emergent care at a hospital, or they could be delayed and transferred eventually. And so in this mechanic, you role play field paramedics who have to triage at the scene, and then you have to flow the patients actually to the hospitals. But you also have to keep in mind that you need an ambulance, or sometimes the city bus comes into play, or a helicopter, and you have to like use these vehicles to get them there. It's not like magic. You can't just sort people and they magically disappear. But the hospitals also have their own intake. And so there's a rate for the intake of the patients. Like they can only absorb so many patients. So that's why we have ambulance delays. And it explains to people that pathology in our system, that they'll understand that at a major trauma center they can absorb more patients, and a little community shop you might have to wait a couple of turns before all your patients can be offloaded from the ambulance. So that's the general sense of those games. And so if you're interested in finding out more, you can check out our website, and I'll put that in the chat later.
I feel like one of those skills your game also teaches, I've heard you speak about before, is the closed loop communication too, right? A chance to practice that sort of communication. I'm going to go over here and do this, like you would play Pandemic or any other sort of co-op tabletop game.
That's exactly what it is, right? Because it's a complex tabletop game, more like Risk, more like Pandemic. Actually, it's more like Pandemic because Pandemic is you against the board, and here it's also you against all the cards. And so the idea would be that because it's a collaborative game, you do have to coordinate. And so what ends up happening is someone's got the marker and marking down the cards, and someone else is like, okay, 2 doc turns and a nurse turn. And you actually learn how to do closed loop communication. And that's been one of our study findings when we did the research. And then it's about taking that concept that they just learned in the gameplay and saying, okay, in reality, in resuscitation, we actually do this, everyone. And people are like, oh, that's so cool. And even 7-year-olds understand that. They're like, that makes sense, because they just did it in the game. So that's kind of one of the cool aspects.
Yeah, I think those of you that are like thinking about making your own game right now, I want to stop and think like maybe the skill you want to teach is not really emergency room flow, but maybe the skill you want to teach is closed loop communication. And how can you work that into your game, right? What are those other skills that we can be teaching beyond the granular, this protein does this, or whatever other sort of finite facts we're teaching? I think that's some interesting stuff that's coming. Tom.
I'm just going to add one thing. There's a game called Space Team
Oh
that
yeah.
if you just want to talk about like a fun game that is all about closed loop communication. It like literally can teach that micro skill to anyone. And it's because basically everyone logs in on the same Wi-Fi, and then you actually be like, okay, so that everyone's got a different dash, and like I might call out to Mike, be like, okay, there's a command that says you have to turn the dial, and I don't have a dial. So I have to like yell it at everyone else. And eventually Mike be like, oh yeah, I got a dial, I'll turn the dial. And so like, you know, after a couple of rounds of that, like your residents just repeat after each other everything they say, because they're like really checking in and getting that closed loop communication habit. Right.
It's like running a code. All right, Tom, take it away.
Hi, everyone. My name is Tom. I'm also emergency medicine in Houston, Texas. And yeah, I mean, I love all of these examples everyone shared. I think one of the things I've been really interested in the products I've worked on is trying to better target those topics that seem more nebulous, you know, the kind of the skill or trait of this expert clinician that people can't really tell you how to get other than give it X years. And so Gestalt, the game shown here, is trying to capture some part of that. So it's kind of a digital card-based game. So you swipe very much like you would in a mobile dating app. Left is not sick, right is sick. And what you can see in some of these screenshots is that you're presented with a case presentation. It might have a radiograph. It might just be a chief complaint and an age, and all sorts of other clinical features are shared with you. And you have to decide with just that information whether you think that this person is sick or not. And the game also tries to capture some of the more intricate components of that decision making by creating this sort of weighted score, where obviously we think it's more important to identify a sick person than, for example, missing a not sick one. And so there are some follow-up cards that come up that try to capture whether or not you really understood what was happening. And if you advance, I think there will be a little video demo of kind of what the interaction's like. So you get a little stack of cards. You swipe through. You can select kind of, you know, your impression. You get results at the end, and it's free.
And you'll have to tell us how you make something like that at during one of the breakouts, because I'm sure that looked super cool.
All right. So I'm Eric Gantwerker. I'm an associate professor of otolaryngology at Zucker School of Medicine. I'm not an emergency medicine physician. But I also work for a company called Level X. So Level X, we're sort of, if you didn't notice, we're going from sort of more the board games to the video games. And then we're probably the highest end of the video game spectrum. You know, we're creating, you know, we have our own engineers, our own artists, our own game designers that are sort of creating our own procedure-based games, as well as more fundamental-based games, cognitive decision-making games. We actually have some knowledge-based games now. So we're doing a bunch of different mechanics with a bunch of different things. And so what we try to do is we try to take whatever the skill is that you're trying to do, whatever the gap is, and try to fit a game mechanic to it. So we're sort of doing it across multiple different disease areas, multiple different specialties, and multiple different skills. So the top one here is actually a picture from our Palmex game where you're actually taking a nail out of the lung. And so this is very procedure focused. We're mostly app-based, mobile-based games. Our game is also completely free, available to download. You can play it now. And you can have 6 degrees of freedom between the scope head and advancing, retracting. You take this out. We have real-time physics running on the back end. So everything you do is actually in real time, and it's actually telling you based on the physics, based on the fluid dynamics, what's actually happening. The lower panel is actually one of our augmented reality games. So this was actually a mechanism of action game for a paralytic reversal agent. So it's a gallery shooting game in AR. So you're actually shooting the little Cheerios at the green, which is the drug that's in the bloodstream. And below it, you can't see it, but there's a neuromuscular junction where the drug is actually located. And eventually you'll create a concentration gradient and actually come off of the neuromuscular junction back into the bloodstream. So that you understand how the reversal agent is actually working, is it's actually binding and creating concentration gradient. So again, trying to use game mechanics that are almost tangential to the education. And so that's something that you'll see as a common theme through this, is that these are very, very simple mechanics, that are teaching you very, very complex things. And when the goal of the game is tangential to the goal of learning, actually that's where the magic happens. So here the goal is to get the most points and hit the most green things. But by doing so, you actually understand what's actually going on a more complex basis. And there's a QR code for my own, that's my contact information.